Assalamu alaikum. Welcome to Agamir Pothe. I hope all of you are well and keep it safe. Tonight, the discussion is about COVID-19 and domestic violence. To discuss this, I have three guests here with me. Not in the studio, sorry, join me virtually. দর্শক আশা করি আপনারা সবাই ভালো আছেন। আগামী পথে অনুষ্ঠানে আপনাদের সবাইকে স্বাগত জানাচ্ছি। আজকে আমরা ডিসকাস করতে যাচ্ছি কোভিড-19 এবং ডোমেস্টিক ভায়োলেন্স নিয়ে, এবং এই আলোচনায় অংশগ্রহণ করতে আমার সঙ্গে ভার্চুয়ালি যোগ দিয়েছেন তিনজন অতিথি। আসুন তাদের সাথে আমরা পরিচিতি হয়ে নিই। প্রথমে পরিচয় করিয়ে দিচ্ছি পিয়া মাইনিন, Solicitor এবং community activist. She lives in London. দ্বিতীয়ত Khurshid, senior social worker and community activist who lives in Birmingham. And finally Shaikat Rushdie, all the way from Canada, Toronto. He's a journalist and political analyst, এবং he's also used to work for BBC World Service in London. He used to live in London year between 1983 and 1986. Welcome to all to my show, and thank you for joining me to discuss this hugely important issue. আলোচনা শুরু করবার আগে আমরা একটু ডোমেস্টিক ভায়োলেন্সের ডেফিনিশনটা জেনে নিই। আমাদের দর্শকদের উদ্দেশ্যে আমি একটু ডেফিনিশনটা পড়ে শোনাচ্ছি। Obviously domestic violence definition vary করে country through country possibly, but according to gov.uk actually, so I'm going to read the definition from the UK government website, which is saying any incident or pattern of controlling, coercive or threatening behavior, violence or abuse between those aged 16 or over who are or have been intimate partners or family members regardless of gender or sexuality. This can be the violence can be psychological, emotional, physical, sexual or financial or various others. Domestic violence happen in all socioeconomic groups, regardless of background, gender, age, ethnicity, sexual orientation, religion, or income. However, while domestic violence affects men and women, statistics show that more women are victims of domestic violence than men. According to the Department of Justice, 76% of cases are women victims. Domestic abuse is never fault of the person who is experiencing it, and domestic abuse is a crime. Okay, so move on. আমরা সকলেই অবগত আছি, মোটামুটি aware আছি যে domestic abuse charities are reporting massive increase in domestic violence since the beginning of the COVID crisis. শৌকত ভাই, আপনার কাছে আমার প্রথম প্রশ্ন, করোনাকালীন সময়ে ঘরোয়া সহিংসতার ঘটনা বৃদ্ধির পেছনে সম্ভাব্য কারণগুলি কি কি?
ধন্যবাদ। আমি আসলে তো বিশেষজ্ঞ নই, একজন সাংবাদিক হিসেবে যে সমস্ত তথ্য আমরা দেখতে পাই বিভিন্ন গবেষণা থেকে এবং গণমাধ্যমে, সেখান থেকে বলতে পারি। প্রথমে আগে আমাদেরকে বুঝতে হবে যে এই কোভিড-19 বা করোনা ভাইরাসের সংক্রমণটা একটা মহামারী বা এপিডেমিক না, এটা একটা প্যান্ডেমিক, মানে অতিমারী। পৃথিবীর 217টা দেশ এবং টেরিটরিতে এটা সংক্রমণ ঘটেছে, এবং এ পর্যন্ত আপনারা জানেন যে পৃথিবীর 7,82,55,000 লোককে সংক্রমণ করেছে। এই তথ্যটি 13ই নভেম্বর পর্যন্ত। তো আমি একটু সংক্ষেপে ব্যাপকতাটা বলবো যে এর এক্সটেন্সিভনেস এবং গ্রুসামনেস, যে কতটা ব্যাপক এবং কতটা ভয়াবহ। এই অতিমারিতে আক্রান্ত মানুষ এবং মৃত্যুর সংখ্যা ও হারের দিক দিয়ে যদিও সবচেয়ে খারাপ পরিস্থিতি মার্কিন যুক্তরাষ্ট্র, ভারত ও ব্রাজিলে, আমরা অবশ্য যেহেতু বাংলা ভাষাভাষী এবং বাইলিঙ্গুয়াল শ্রোতাদের কথা ভেবে আলোচনা করছি, আমরা মূলত ফোকাস করব বিশ্ব পরিস্থিতি ব্রিটেন, বাংলাদেশ এবং আমি যেহেতু কানাডায় থাকি, কানাডার কিছু পরিসংখ্যান দিয়ে। আপনাদেরকে একটু পরিসংখ্যান থেকে বললেই বুঝবেন, যেটা আমি একটা ভাগ করেছি। পৃথিবীতে 7,82,55,000 লোক আক্রান্ত হয়েছে 13 নভেম্বর পর্যন্ত। অর্থাৎ প্রতি 145 জনে একজন। পৃথিবীর জনসংখ্যার প্রতি 145 জনে একজন, 0.69%। আর এর মধ্যে প্রতি 41 জনে একজন মারা গেছেন। ব্রিটেনে এই সংখ্যাটা 6,80,00,000 জনসংখ্যার মধ্যে 1.98%, অলমোস্ট 2%, যেটা আপনার প্রতি 50 জনে একজন সংক্রমণ ঘটেছে এবং মারা গেছে প্রতি 26 জন রোগীর মধ্যে একজন। কানাডাতে 3,78,00,000 জনসংখ্যার মধ্যে 0.77% সংক্রমণ ঘটেছে, মানে 130 জনে একজন, এবং মারা গেছে রোগীদের মধ্যে প্রতি 27 জনে একজন, প্রায় ব্রিটেনের সমান। বাংলাদেশের পরিসংখ্যান সরকারিভাবে যেটা দেওয়া হয় সবসময় বিশ্বাসযোগ্য হয় না, কারণ খুবই কনজারভেটিভ ফিগার দেওয়া হয়। সেখানে 16,52,00,000 পপুলেশন বাংলাদেশের জনসংখ্যা, তার মধ্যে বলা হচ্ছে যে 0.26% লোক সংক্রমণ ঘটেছে, 4,30,000-এর মতো, এবং সেখানে প্রতি 385 জনে একজন সংক্রমণ ঘটেছে এবং মারা গেছে প্রতি 70 জন রোগীর মধ্যে একজন। এবং এর মধ্যে আপনার যারা মারা গেছেন তাদের মধ্যে আপনার পুরুষের সংখ্যা মহিলাদের চেয়ে একটু বেশি। পার্সেন্টেজটা এই মুহূর্তে আমার সামনে নেই। তবে এগুলো বলবার পেছনে কারণ হলো যে কোভিড-19 যে সমস্ত ইম্প্যাক্ট রয়েছে মানুষের জীবনে, তার মধ্যে প্রথমেই হচ্ছে স্বাস্থ্যগত, যে অসুস্থতার আশঙ্কা, কোয়ারেন্টাইনে থাকতে হচ্ছে, অসুস্থদের জন্য আইসোলেশনে থাকতে হচ্ছে, রোগীদের হাসপাতালে নিতে হচ্ছে, অক্সিজেন সহ বিভিন্ন চিকিৎসার ব্যবস্থা করতে হচ্ছে। তারপরে কিন্তু ইকোনমিক, সারা পৃথিবী একটা স্থবির হয়ে গেছে, কাজ হারিয়েছে মানুষ, যাদের কাজ আছে তাদের আয় কমে গেছে, এবং অর্থনৈতিক মন্দাও দেখা দিয়েছে পৃথিবীর বিভিন্ন দেশে। এরপরে রয়েছে সামাজিক, যে লকডাউন এক নজিরবিহীন স্থবিরতার মধ্যে ঠেলে দেওয়া হয়েছে গোটা সমাজকে। কিছুটা খুলেছে যখন লকডাউন, আবার সামাজিক দূরত্ব, মাস্ক, হাত ধোয়া, বিভিন্ন ধরনের সামাজিক ও মানসিক চাপ তৈরি করেছে। আবার শিক্ষার্থীরা, স্টুডেন্টরা পড়াশোনা ছেড়ে একঘেয়েমিতে ভুগছিল। আর সবচেয়ে এগুলো সবই দৃশ্যমান, কিন্তু আর যেটা দৃশ্যমান নয় সেটা হচ্ছে মানসিক স্বাস্থ্য, অর্থাৎ মেন্টাল হেলথ। একটা পরিসংখ্যানে দেখা গেছে, সম্প্রতি অক্সফোর্ড ইউনিভার্সিটি রিপোর্টটা প্রকাশ করেছে এবং ব্রিটেনের ল্যান্ডসেট সাইকিয়াট্রিতে প্রকাশ পেয়েছে গত 9 নভেম্বর। সেখানে বলছে যে বেঁচে যাওয়া কোভিড-19 রোগীদের প্রায় প্রতি 5 জনে একজন, মানে 18%, 90 দিনের মধ্যে মানসিক স্বাস্থ্য সমস্যা আক্রান্ত হওয়ার ঝুঁকি রয়েছে। এই মানসিক স্বাস্থ্য সমস্যার মধ্যে রয়েছে উদ্বেগ এবং বিষণ্ণতা, মানে অ্যাংজাইটি এন্ড ডিপ্রেশন। কোভিড-19 আক্রান্ত হয়ে বেঁচে যাওয়া 62,000 রোগী সহ মোট 6,90,00,000, মানে খুবই এক্সটেন্সিভ মানুষের চিকিৎসা সংক্রান্ত রেকর্ডস রিভিউ করে এক গবেষণায় এই ফল পেয়েছে অক্সফোর্ড বিশ্ববিদ্যালয়ের এক গবেষণা দল। এবং এই যে রিস্ক ফ্যাক্টর, এটা হচ্ছে ইনফ্লুয়েঞ্জা, রেসপিরেটরি প্রবলেম, কোনো বোন ভেঙে যাওয়া, স্কিন ডিজিজ, পিত্তথলি বা কিডনির পাথরে, বিভিন্ন ধরনের অসুখে ভুগতে থাকলে যে ধরনের মানসিক স্বাস্থ্য সমস্যার সম্মুখীন হয় মানুষ, তার প্রায় ডাবল, মানে দ্বিগুণ। তো ব্রিটেনের চিকিৎসা সাময়িকী ল্যান্সেট সাইকিয়াট্রিতে প্রকাশিত এই রিপোর্টটি অত্যন্ত মূল্যবান, এবং সেই থেকে আমাদেরকে
আমরা
বুঝতে হবে।
পরবর্তীতে এই প্রশ্নে আসবো, কথা বলবো মেন্টাল হেলথ এন্ড ফিজিক্যাল হেলথ ইম্প্যাক্ট ডিউ টু ডোমেস্টিক ভায়োলেন্স। তো এগুলির সাথে এই যে কোভিড এর সাথে করোনাকালীন সময়ে যে ডোমেস্টিক ভায়োলেন্সটা হচ্ছে আপনার বা বৃদ্ধি পেয়েছে, এর পেছনে কারণগুলি কি?
এর পেছনে প্রধান কারণ হচ্ছে অর্থনীতি, দ্বিতীয় কারণ হচ্ছে সামাজিক স্টিগমা। যেমন বাংলাদেশে রোগীদের বাড়িতে লাল পতাকা টাঙিয়ে দিয়েছে, তাদেরকে একঘরে করে দেওয়া হয়েছে, এটা কিন্তু স্টিগমা, একটা ট্যাবু। এটা করাটা ঠিক হয়নি, এটা সরকার স্পন্সর করেছে। পৃথিবীর অন্য দেশে যেখানে হেল্প করছে, কানাডাতে বা ব্রিটেনে, মানসিক স্বাস্থ্যের জন্য, সেখানে হেল্প করছে না, তারা একঘরে হয়ে যাচ্ছে। এটা প্রচন্ড মানসিক চাপ তৈরি করে, তখনই তারা সহিংস হয়ে ওঠে। এবং সহিংসতার ধরন, ডোমেস্টিক ভায়োলেন্স কিন্তু কানাডা, ব্রিটেনের সোসাইটির সাথে বাংলাদেশের সোসাইটি ডিফারেন্ট, কারণ এখানে অনেক ধরনের হয়, ওখানে আরেক ধরনের হয়, সেটা যারা বিশেষজ্ঞ আপনারা ভালো বলতে পারবেন। তবে মানসিক স্বাস্থ্যটা প্রধান, এবং ইকোনমিক ফ্যাক্টরস, একই সাথে সোশ্যাল ফ্যাক্টরই আছে। আমার কাছে ব্যক্তিগতভাবে মনে হয় প্রথম হচ্ছে ইকোনমিক ফ্যাক্টর ইন বাংলাদেশ পার্সপেক্টিভ, এখানে হয়তো ততটা নয়। তবে মেন্টাল ইলনেস যেটা দৃশ্যমান নয়, আমরা দেখতে পারি না, সেগুলো যেহেতু প্রপারলি অ্যাড্রেস করা হয় না, ডায়াগনোসিস করা হয় না, সেজন্য সহিংসতাটা বেড়ে যেতে পারে এবং সেই ঝুঁকিটা থাকে।
অসংখ্য ধন্যবাদ। আমরা ইউজুয়ালি যেটা করি শৌকত ভাই, আমরা একই প্রশ্ন আমরা আমার প্রতি গেস্টদের একটা অপরচুনিটি থাকে অংশগ্রহণ করা, সো দ্যাট আলোচনাটা একটু কম্প্রিহেন্সিভ হয়। সেই কারণে একই প্রশ্ন আমি করছি খুরশিদুল হককে। এটা যদি ইংরেজিতে বলি, যে প্রশ্নটা এমন হবে, What are the potential reasons behind an increasing domestic violence case due to COVID-19? Uh, তো বেসিকলি শওকত ভাই কয়েকটি রিজন দিয়েছেন যে কারণে বৃদ্ধি পেয়েছে আপনার মতে what are the potential reason if you want to add anything.
Assalamu alaikum. Yeah, assalamu alaikum, viewers. Thank you, Hashi. The potential reasons in terms of domestic violence, I would slightly paraphrase that and use the word domestic abuse rather than violence, because I think it's important that we recognize that in those kind of situation, the abuse is the important element here. There are a number of factors with COVID-19, and certainly the lockdown has made the matter worse for a lot of women, particularly those who are subject to domestic abuse. It's important that we recognize the relationship factor and the power imbalance between the two partners. Financial element also has an impact in this, and the power imbalance between men and women is also something that needs to be taken into consideration. Women find themselves in those kind of relationship very sort of oppressed for various reasons. And I mean, I was just looking at some of the sort of research issues, and the charity Refuge, which runs a national domestic helpline, said that they were very concerned by the continuing upward trend in demand of its services, with England and little
Yeah,
over a
we'll
week
come back to
into
the
the second.
services bit later. Yeah, at this
Yeah,
moment we
so
will just, yeah.
so it's the
So it's
power
a
imbalance,
social power imbalance,
power
economic.
imbalance, economics, sort of social differences, the status in the relationship, um, the kind of mental health issues as well is also an important a factor. If within the relationship, the suppressed person has mental health issues from prolonged domestic abuse, then that would have a huge impact in the sort of situation, and how women are sort of oppressed. Within the Asian communities, we also have factors that needs to be taken into consideration. Is a lot of social stigma, language barriers as well. Women who are not able to sort of reach out for services that they need in order to get themselves out of those situations. So they're in double jeopardy, really. So that has a sort of another a trend into the situation, um, and so on. So we
I
these
mean,
are kind of factors.
talking about domestic abuse, we must not forget about male as well, although there are small percentage, but obviously,
I think it's
yeah,
you've
but
highlighted in your sort of opening
yeah, yeah,
sort of remarks that
yeah,
the domestic violence and abuse mostly um, sort of takes place between
experienced by
men and women relationship. Although sort of we understand and we know there are same sex relationship and the violence in that, but we also sort of have an understanding that the power imbalance sometimes shifts between the woman and the man, and the there are abuse, but the
perfect,
percentage are somewhat
much lower
lesser,
than yeah,
rather,
yeah, about
than the other way around.
20% or so, yeah.
Yeah, so we
I
have
mean,
to be mindful about that. So when we look at the overall issues, it's mainly focused on
women,
men women
of course, yeah,
violence in that
yeah,
situation.
absolutely. I mean, I didn't wanted to put myself into predicament whereby people come back to me and say that, oh, you forgot about us guys.
No,
But obviously,
absolutely
I
not.
did made it very clear at the beginning.
One
Yeah.
One of the other thing that I need to sort of just add to the equation is certainly, from myself, from my professional sort of situation, we actually see quite a lot the impact of childcare, and that has a significant bearing as well, and how the children are affected by those kind of relationships as
Hold
well.
that thought for a moment. I'll come back. This question is for you because I
Okay.
know you
Okay.
work in safeguarding, but we'll come back to you. Thank you
All
so much, Piya. Unless
Okay,
otherwise you wanted to add something on this question, next question is
just
yours. So if you would like
just a
to,
little
please
bit.
go on. Go ahead. Yeah,
Yeah,
please.
just a little bit. First of all, I'd like to say that, I mean, although, I mean, I'm not going to repeat anything that my fellow uh, colleagues on this program have already said. But what I'd say that if you, like, yes, we always have to say that men are also victims of domestic violence. I think your question was the why is it happening so much in the
Yes, it was an increase.
lockdown?
Yeah,
Lockdown. So one thing I would say, this phenomenon of this domestic violence during lockdown has been called a shadow, has been
yeah,
called a shadow pandemic. So it in
yes,
itself is a pandemic. Violence against women has been recognized as a pandemic worldwide. There are various countries who are signatories of the violence of the CEDAW, the I won't even attempt to remember, but is basically the violence against women international legislation. And so, therefore, in this pandemic, also, you can see that two-thirds of the violence has been in abusive relationships. Two-thirds of them are women. So it is always much more women. Also, you can't just to get that it is predominantly against women. And also, why it's happening, because it was already there, because domestic
absolutely.
violence has not been dealt with. I mean, what has been a draft bill for domestic violence, um, to deal with domestic violence, because there's no statutory definition now. And um, uh, uh, and so what a draft bill is in Parliament right now. They're trying to get some things to be looked at under the bill, including the statutory definition, and also to clarify things, because there's weaknesses that are still letting far too many people, or victims, not get their justice. And of course, finally, I'll just say that, of course, we all know that emergency services are not available. We're in another lockdown now, but earlier on in the year, there were no emergency services available. And of course, the mental health issues and things are there. But I mean, I would say that that is why, because the emergency services are not there, the law is not adequate to deal with it. And so, it's just the lid has been suddenly taken off and all this has come out because we were in a lockdown.
Yeah, absolutely. Thank you ever
Yeah.
so much. I mean, you guys almost kind of, as everybody kind of touched the main bit of it. Pia, I was going to coming to you next, and before I ask you the question, I was just going to read statistic. The UK's largest domestic abuse charity reported a 25% increase in calls and online requests since the lockdown began in March 2020. Calls to a national domestic abuse helpline rose by 49% and killing doubled weeks after lockdown, a report by MPs has revealed. What is your take on that? You already touched it, and how women and girls are impacted by growing incident to
So
you.
আমি যেটা আচ্ছা, আমি কি বাংলায় বলবো নাকি ইংলিশে বলবো? I don't know, because
I
you have
think
Bengali.
as you feel comfortable, but I think if you say in English, this is why question is in English, but
Oh,
you can
okay,
say
fine.
it
Okay,
as you feel
absolutely.
comfortable, or you
Okay.
could be bilingual.
I must clarify that I'm not a specialist as such myself. I'm a lawyer, and because I work with family law and divorce law and children arrangement and things like that. I deal with domestic violence through that, and from my experiences in various capacities in the community, including having children myself who are teenagers and adult as well. So that's where
When I
get
say
my,
girls, because according to the definition,
yeah,
you as a lawyer, you probably know, it's been some years now, government definition has changed, and they included
yeah,
16 years old, and this is why
yeah.
I said girls. So yeah, it's up to 16 years. So how are they impacted? Looking at the statistic, I mean, it's gone up 25%,
How are they? Okay. Well, I mean, I would say largely,
and there is loads of killings, 49% of pool.
yeah. So largely, again, I would say if you look from 2005 onwards to about 2019, there was a slight decrease. Again, I'm talking loosely. I haven't got the exact, but I'm quite accurate. I know I'm accurate about there was a slight decrease, and
No,
then in the
we're
pandemic,
talking after lockdown, since the lockdown began. So
yeah,
basically, yeah, during the COVID, as a result of COVID, domestic violence has increased
mhm,
25%. The calls, all the major organization, including Refuge, are reporting 25% call increase. Even according to UN, and I've seen other websites as well. So worldwide, basically, it has
yeah.
increased. Yeah, and as a result, how women and girls are impacted.
Well, women and
You
girls
touched
are,
it because as we were
yeah,
talking, it's
there's
get
two
something
sides of it.
overlapped here.
They're hugely, I mean, they're impacted most
But
of all because
specifically
the
women and girls.
2/3 of the abused are women and girls. And, usually this happens. Domestic violence is, as you read out the definition before, it's recognized in intimate relationships. It doesn't have to be husband and wife. It can be,
Absolutely.
brother and sister,
It could
father and
be
daughter,
absolutely. It could be anyone living in
mother and
the
son.
yeah.
Yeah, and unfortunately, that's how it's globally. If you look all over the world, for because women are the weaker sex. That my one of you guessed, Mr. Khurshid al-Haq. I think he touched on that because of course there is a power imbalance. It's about power, and women have less power. Societally, they have less power. Within the families, they have less power, and therefore we need adequate law to
Tell with it.
combat this. If you look at worldwide, especially developing countries and things like that, sometimes even the legislation is not enough, because if it's not
Do you
tightly legislated
absolutely
and it's
yeah,
not
but
enforced properly,
do you think there has been like physical and emotional damage? I'm gonna come back to it, physical,
yeah,
emotional in details, but in terms of when I say women and girls, it's just we're just because we're just at the beginning of the discussion, we're just kind of having brief idea of everything gathering, and then we'll go much into depth
actually, yes, of course.
later
I mean,
on.
violence is there is. I mean, I'm dealing with a case right at the moment that she's having so much trouble proving the violence, because it's not physical violence. Violence doesn't have to be physical. It's emotional, it's
Emotional
financial,
is
it's
the yeah,
controlling. Yes.
absolutely.
And and this girl is she's
Could be eating,
subject to all of that, and because she hasn't got any scars, or because she hasn't got any police records,
but
you don't
she
go to
might
the
have a
police and say
scar in her heart. You don't know how emotional scar. You never know.
abuse is such that it often the scar remains forever in some
So
people. Some
she
people are
might have
able to.
sleeping disturbance. She might have eating disturbance. I mean, she might be going through a whole lot. You never know. Shokotai, did you
Absolutely,
wanted to?
absolutely.
Yeah. Thank
Yes,
you, Piya.
in
Did you
fact,
wanted to add something on this? Then we'll move on to next question, which is going to be your Shokotai.
রাইট। আমি আসলে এই বিষয়ে একটা সম্প্রতি প্রকাশিত গত অগাস্টের 25 তারিখে কানাডায় প্রকাশিত একটা রিপোর্ট থেকে খানিকটা কোট করতে পারি। এটাতে বলা হয়েছে যে gender based violence during the height of the COVID-19 lockdown in Canada was more severe and more frequent, according to the first national survey of those who work with sexual assault and domestic violence survivors during the pandemic. Almost as soon as the pandemic began, agencies helping survivors of domestic violence warned that victims would suffer as a result of quarantine rules, and a survey of 376 staff and volunteers working at transition houses, shelters, immigration centers, and other social agencies coast to coast confirms those fears. Almost half of those surveyed said they noticed changes in the prevalence and severity of violence, with 82% saying the violence increased and got more frequent. A fifth said abusers' violent tactics changed and control over their victims increased, including a sharp uptick in cases of strangulation, the survey found. এর সাথে প্রাসঙ্গিক হলো যে normal not an option. There is a deep concern on the part of volunteers and staff that returning to normal will not be the possible due to the harm caused by abusers and the increased services that will be needed to properly help families to recover.
আচ্ছা, সো সেটা স্পেসিফিকলি কানাডা।
আমি এটা কানাডাতে একটা ন্যাশনাল সার্ভে রিপোর্টটা পড়লাম, তো এটা পৃথিবীর বিভিন্ন দেশে এই প্রতিফলন আছে নিঃসন্দেহে।
Khurshid, did you want to add anything, or shall I just move on to next question?
Very quickly, I think, I mean, I was just reading an article from the Guardian, and it just want to sort of very quickly give you a small quote. The rate of killings is conspicuously steeped in the opening period of the first lockdown. So that tells us, and how that is now. There are sort of also figures saying that, more than 40,000 calls were made, during the first 3 months of COVID-19 restrictions. So, it is clear the number of cases and the abuses reported from the various organizations who are in the heart of working with women who are in those kind of relationship. So just to add that, I think it's had a huge impact on domestic abuse, and we cannot sort of disregard that at all, in terms of the services that is provided. I think Piya was talking about earlier on about having the right definitions and stuff like that. But at the end of the day, it's those women who are in those relationship are affected quite severely, from various angle.
Thank you so much indeed. Next question, Shaikat bhai, আপনার জন্য বাংলায়। করোনা ভাইরাসটি সারা বিশ্বে ছড়িয়ে পড়তে থাকায় এবং লকডাউনের শুরু থেকে ঘরোয়া সহিংসতার বৃদ্ধি পেয়েছে, এর নেতিবাচক পরিণতি কি? মানে জাস্ট নেতিবাচক যে কনসিকুয়েন্সেস গুলি, যেগুলি নেগেটিভ কনসিকুয়েন্সেস গুলি।
ওয়ান অফ দ্য রিজনস যেটা আছে, পরিণতিতে আসার আগে একটু বলে নি যে আমরা বলেছি আগে যে ইকোনমিক আসপেক্ট একটা গুরুত্বপূর্ণ ব্যাপার, যে আর্থিক দিক দিয়ে ক্ষতিগ্রস্ত হয়েছে মানুষ। আবার যে সমস্ত পরিবারে মানুষ মারা গেছে তাদের ওয়ান অফ দ্য ব্রেড উইনার মারা গেছে, যারা রুটি রুজি সংস্থান করে। তো একটা যে ভীষণভাবে অর্থনৈতিক সংকটে পড়েছে, সেটাও কিন্তু আপনার অর্থনৈতিকভাবে ক্ষতিগ্রস্ত করেছে এবং সেটা মানসিক চাপ তৈরি করেছে। এবং এটা ডোমেস্টিক ভায়োলেন্স বা ডোমেস্টিক অ্যাবিউজ কতটা বেশি করেছে তার একটা ছোট্ট রিপোর্ট আমি দেখতে পেলাম। কানাডার যে মিনিস্টার ফর উইমেন অ্যান্ড জেন্ডার, তার নাম মারিয়াম মনসের, বলেছেন যে COVID-19 crisis has empowered perpetrators of domestic violence as consultations reveal that abuse rates are rising in parts of the country. বলছে যে যারা ডোমেস্টিক ভায়োলেন্স করে থাকে, যে সমস্ত মানুষরা, সে পারপিট্রেটরদের ক্ষমতা যেন আরো বেড়ে গেছে এই সময়টায়। তো সেটা বেশিরভাগ ক্ষেত্রে পুরুষদের সহিংসতা হয়েছে, কোথাও কোথাও নারীদেরও হয়েছে, খুব সামান্য। তা এগুলো আমরা যে সকল রিপোর্ট দেখতে পাই। আর কানাডার কথা বলছি, ব্রিটেনের কথা বলছি, কিন্তু আমরা যদি মনে করি বাংলাদেশের কথা, বাংলাদেশে কিন্তু বেশিরভাগ ক্ষেত্রে ডোমেস্টিক ভায়োলেন্স আনরিপোর্টেড থেকে যায়। মানসিক অসুস্থতা আনরিপোর্টেড থেকে যায়। সেখানে একটা ডিনায়াল আছে যে আমার মানসিকভাবে অসুস্থ। দেখা যাচ্ছে 92% মানে 92% লোক বাংলাদেশে মানসিক রোগে যারা আক্রান্ত তারা যায় না চিকিৎসকের কাছে। তো এই পরিণতিটা খুব ভয়াবহ রকমের দীর্ঘমেয়াদে লং টার্ম ইফেক্ট করবে এবং সেটা সোসাইটিকেও এফেক্ট করবে। মানুষের প্রতি তো করবেই মানসিকভাবে, কিন্তু সোসাইটিতেও করবে। আমরা সেই জন্য আমাদেরকে আগে থেকে এ ব্যাপারে সতর্ক হওয়া দরকার, ডায়াগনোসিস করা দরকার, পিন পয়েন্ট করা দরকার হোয়াট আর দ্য নিডস টু অ্যাড্রেস দিস।
হ্যাঁ, এগুলির সাথে সাথে স্কুলগুলি যে বন্ধ সেটা আরেকটা ব্যাপার। ফিজিক্যাল, সাইকোলজিক্যাল, ইকোনমিক আপনি মেনশন করেছেন, স্কুল বিজনেসেস being closed, এগুলোর একটা ইম্প্যাক্ট, সিরিয়াস ইম্প্যাক্ট আছে আপনার। anyone wants to add anything to?
I just want to touch on the point about unreported incidents. Shaikat has said that that in Bangladesh there are a lot of the cases which are unreported. I think it's important that we note that in this country, and we get that in our profession, there are a huge number of cases which are unreported, even in this country. Surprisingly, women, for a lot of reasons, they don't report domestic abuse, for the financial security, for their children, if they're in relationship with children, they don't want to lose their children. The breadwinner may be the perpetrator. They don't want to be in that situation. They feel that without the partner, they will not be able to survive. And all of those factors are so important in the case of domestic abuse situation that we need to analyze. So it's not, and I'm not sort of saying that the information that you've shared, Shaikat, is only sort of in Bangladesh, but I think we need to have a balance that it really does reflect in our society, in our modern society. So when you compare the modern society, whatever the element of power that women have in order to sort of do certain things, on their own, that then compounded by much more in the countries where they don't have any say in at all. So I think that's the balance that we need to
observe, that the people, those third world country, particularly in the first world country, your Britain and Canada, those families are mostly unreported here.
Yes.
So যেটা খুরশিদুল হক বলছিলেন যে consequences are greater, so women has to, like, not only just third world country, being in a developing country, we know, we all kind of, we have general observation, we read the news, we see what's been happening, we not most cases are reported because of those consequences that we have to face. There are housing issues. No one wants to end up going to refuge. People have children. Yes. They have to think about people's children's school, their caring responsibility. Say, for example, a typical example, women, if a typical family, if they are used to living in a 3-4 bedroom house, and all of a sudden this incident happened and they have to report to the police and they've been housed to refuge. Can you imagine, they, as a parent, as a mom or as a father, first and foremost you think about of children. Why would you end up going to refuge in a 1 or 2 bedroom crowded environment which your children won't be not even comfortable? Do you understand? So those are the consequences that you just mentioned.
Sorry, Hashi, that is another factor that I think important that we need to take into consideration, is the uprooting of the entirety for the family. They'll have to sort of move the school of the child, so the children go into a strange place, not have any friends, not have any family ties, and if they're going to refuge, it could be miles away, it could be 50, 60, 100, 200 miles away from their sort of current network. Nobody wants to do that. Let me just share an example with you guys. I've worked with a case of 3 children and a young couple. the man who was so abusive to an extent where he dug a grave in the back garden to bury his partner alive. Even to that point, the woman did not report. It was only quite substantially later that we found out about the situation. And sadly, sometime these kind of situation goes against the women in the sense where we have to, sort of initiate care proceedings because of the fact that the woman were not able to protect the children. But what she was doing, she was trying to sustain a balance within the relationship and thought what would be the very best for her to safeguard her own children, but she
Absolutely.
wasn't able to do that. So these are
I
the
mean,
kind
I
of level that we were talking about.
And
When
also
it comes
in
to,
terms of other pressure, like we did talk about taboo and stigma, pressure like family pressure.
yes, absolutely,
Yeah, the stigma they have to say, oh,
community pressure
say
also.
for example, she
yeah,
called police and got her husband arrested just because of a slap or just because of an argument. Do you understand? So
mm,
these are the consequences one has to face before they take a step. But having said that, it doesn't mean we are not suggesting anyone not to take a step. First and foremost, where there is an incident, people must
Hashi,
call
can I
999.
come
Yeah,
in here
of
at all?
course. Yeah,
Because
yeah, of course.
I mean, I think there is also a problem about domestic violence against women. I don't mean any, um, um, I don't mean to, um, I
Exclude
don't
men.
know, exclude men, and I don't mean to provoke them either. But what I'm saying that as a domestic violence as a woman is not taken seriously enough, not even by the police. The police, I mean, there have been instances when women have called up 17 times, 20 times, 40 times, and the police are not taking it seriously until the woman has been killed. And this is a Bengali community in Birmingham, in Manchester, in London, and all that. বাংলাদেশের কথা তো I'm going to just touch on that in a minute. ওখানে তো আরো worse. কারণ হচ্ছে basically what we're looking at, it's the societal and the cultural stigma that is the most important. এই যে ঘটনা ইয়ে বললেন খুরশেদ আল হক, উনি যে বললেন যে this thing, I mean, I wouldn't see it as that's a healthy place to be, but the woman doesn't know that it's not a healthy place to be. মানে সে জানে না এটা যে unhealthy, কারণ হচ্ছে the society expects her to be there regardless. If she
This
was
is where
spoke
the
out,
question was
society
about the
would judge her.
consequences, isn't it? And
Yeah,
this is
so
where we're
society
talking about the
society
consequences. Yeah.
would judge her. আর ওখান থেকে Bangladesh and developing countries, if you look at them, their situation is worse because এক তো আছে this cultural bias against women and judgmental. Money, anything that happens, first of all, it's against the women. Then money, even if they find out it's actually the man, well, no, the woman must have done something to aggravate him. আচ্ছা যাই হোক, that's one part of it. তার উপরে corruption, police, even এখানে এখানে মানে এই যে the levels are different, the cultures are a bit different. ওখানে তো corruption, bribe, this and that. Police will say এটা বাদ দাও, রেপের কেস বাদ দাও, এটা পারবা না,
ওখানে
you
তো
won't,
রিপোর্টই নিবে না, ফার্স্ট এন্ড ফরমোস্ট রিপোর্টটাই লিখবে না
বাংলাদেশে
বাংলাদেশে।
এটা মানে তোমার ফ্যামিলির ইয়ে হবে, তোমার ফ্যামিলির লজ্জা, এটা this and that and the other, this societal pressure. তো এটা আছে ওয়ার্ল্ড ওয়াইড, ডিফারেন্ট কালচারস আর ডিফারেন্ট থিঙ্কি। হিয়ার ইট ইজ, হিয়ার অ্যাট লিস্ট যখন মানে লকডাউন না, কিছু কিছু অ্যাভেলেবল ফ্যাসিলিটিস আছে যেগুলি ইউজ করা যায়। so and therefore there was a trend that was coming down, but এখন দেখা যাচ্ছে was it actually coming down, or because oil facilities গুলো আছে it was sort of under control. However, it's not going away. So I mean, my main point is that we need a huge cultural revolution. Money to change age women. Why does she feel in order to prove herself as a woman, as a good woman, she has to live with this abusive man? And she yeah, so money এটা
just
তো করে,
to kind of sustain her images, reputation.
yeah. And
on
but
that
she could
basis,
well,
sorry, on
It
that
is
basis,
well understood.
No,
Yeah.
carry on. Interesting
yeah,
discussion. I mean,
what,
is it
on
leading to
that
next
basis,
question, but if need be, we'll skip that question, carry on.
okay, on that basis, I think it's important that we sort of understand and about educating society, educating men, about the expected way of a woman needs to be treated, and we talk about sort of societal expectations and all that kind of stuff, right? Often it's it's a man-made society that has those kind of influence. Another point that I wanted to sort of add to your point, Pia, is that and again drawing sort of parallel between here and third world country in the sense that women who are sort of Asian women in this country who don't report often domestic violence is also due to the racism within the institution, and I think that's something that we need to be taken into consideration. So if they have a language barrier, if they have a language problem, they're not going to, who's going to listen to them? Their concerns don't get through, and you're saying that the police don't take these matters seriously. They're not going to take their sort of matter seriously if they're not able to communicate well. I attended a training on honor killings, honor-based killings, within our sort of community or our society in this country. And if we look at that, the seriousness is so huge. It's unbelievable, and we're talking about in the 21st century that we're living in a much more moderate and sort of advanced society. If we having all those resources and economical sort of wealth within our within our society are experiencing these kind of issues, right? I don't think there is any comparison within the third world countries at all. The women will continue to suffer. So we have to make a stand, and we have to get the definition correct, the right kind of definition that applies to sort of communities in different sort of parts of the world, and lobby that. And unless we're in a situation and able to sort of lobby that and take it forward, I don't think we're going to be able to sort of deal with this. We will continue to have these kind of debates. We will continue to have reports, and they will just be figures at the end of the day. They'll just be numbers.
True.
Absolutely, I totally agree with that. I mean, in the bill that's going through, in addition to the definition, they're also working on. I mean, I know at the moment there's a domestic violence unit. However, this has got to be taken up a few steps. But there's what is being proposed is the Office of Domestic Abuse Commissioner, and he has certain functions and powers, more for local authorities to take more responsibility to help people in sort of domestic violence situations, as well as a number of things which I wasn't able to look through properly.
আমি এখানে একটা অ্যাড করতে চাই, সেটা হলো যে কানাডাতে যেমন ধরেন ব্রিটেনের ন্যাশনাল হেলথ সার্ভিস থেকে স্বাস্থ্য সমস্ত চিকিৎসা ব্যবস্থা ব্রিটেনে সরকার বহন করে, এখানে কানাডাতেও আপনার প্রাদেশিক সরকার বহন করে, শুধু আই ভিশন পরীক্ষা ছাড়া বাকি সবকিছু। এখানে এই সাপোর্টগুলো আছে, ফিনান্সিয়াল সাপোর্ট, হেলথ সাপোর্ট আছে। তারপরে যে একটা ছোট্ট পয়েন্ট বলে রাখি, যে আপনারা বললেন যে অনার কিলিং, এটা আমাদের এখানে লক্ষ্য করা গেছে শুধুমাত্র দুটো কমিউনিটির মধ্যে আছে, আফগান এবং শিখ কমিউনিটি। আর বাংলাদেশি কমিউনিটিতে অন্য একটা ঘটনা ঘটছে গত 2-3 বছর ধরে, সেটার সাথে সম্পর্কিত না, কিন্তু মানসিক স্বাস্থ্যের ব্যাপার। সেটা টিনেজার ছেলেমেয়েরা সুইসাইড করছে, 1 বছরে 7 জন করেছে। এটা হচ্ছে কালচারাল কনফ্লিক্ট থেকে, তাকে হয়তো খুব বেশি রিলিজিয়াস করে তোলা হচ্ছে। তো সেগুলো আমাদের অ্যাড্রেস করতে হবে বিভিন্নভাবে। তো এখানে যে সকল সাপোর্ট গ্রুপ আছে কানাডাতে বিভিন্ন ধরনের, যেমন ধরেন এই যে কোভিডের সময়, লকডাউনের সময় আপনার সরকার বিভিন্ন ধরনের ফাইন্যান্সিয়াল সাপোর্ট দিয়েছে, এখনো দিয়ে যাচ্ছে। এখন আবার তখন তো ইমার্জেন্সি প্ল্যান ছিল, মাসে $2000 করে দিয়েছে। সামার জব পাচ্ছে না বলে স্টুডেন্টদেরকে 4 মাস ধরে $1250 করে দিয়েছে। এখন কানাডা ইমার্জেন্সি রিকভারি বেনিফিট দিচ্ছে, তারপরে রিকভারি কেয়ার গিভিং বেনিফিট দিচ্ছে, ইমার্জেন্সি ওয়েস্ট সাবসিডি দিচ্ছে, রিকভারি সিকনেস বেনিফিট দিচ্ছে, মানে ফিনান্সিয়াল সাপোর্ট ইজ দেয়ার। এছাড়াও বিভিন্ন কমিউনিটি গ্রুপ যেমন জিহোভাস উইটনেস গ্রুপ আমাদেরকে ফোন করে জানতে চায় কেমন আছো। আমার স্ত্রী একটা ইয়োগা গ্রুপে অংশ নেয়, আজকে কোথায় গেছে সেটা পার্টিসিপেট করতে। নানা ধরনের সক্রিয়তা আছে ব্রিটেনে এবং কানাডায়। তারপরেও দেখা যাচ্ছে একটা রিপোর্ট, ওই মিনিস্টার মারিয়াম মুনসুফ বলেছেন যে 20 to 30% ইনক্রিজ ইন রেটস অফ জেন্ডার বেসড ভায়োলেন্স অ্যান্ড ডোমেস্টিক ভায়োলেন্স ইন সাম রিজিয়নস অফ দ্য কান্ট্রি, though data on here where the uptick is occurring is not yet available. এবং টরন্টো শহরের উত্তরে একটা জায়গা আছে নাম ইয়র্ক রিজিয়ন, সেখানে 22% কনফার্ম হয়েছে, পুলিশ রিপোর্ট করেছে যে জেন্ডার বেসড অ্যান্ড ডোমেস্টিক ভায়োলেন্স বেড়েছে। অর্থাৎ আমি যেটা বোঝাতে চাচ্ছি, সিভিয়ারিটি, এইরকম সহযোগিতা, সহায়তা, কমিউনিটি সাপোর্ট, সোসাইটাল সাপোর্ট, সরকারি সাপোর্ট, আইনগত সাপোর্ট, ফিনান্সিয়াল সাপোর্ট থাকার পরেও এখানে 22% to 30% বেড়েছে। তো সেক্ষেত্রে বাংলাদেশে শুধুমাত্র আমরা দেখেছি গার্মেন্ট ওয়ার্কারদেরকে কিছু ফিনান্সিয়াল সাপোর্ট দেওয়া হয়েছে, আদারওয়াইজ আর কোনো ফিনান্সিয়াল সাপোর্ট নেই। সেখানে হেলথ সাপোর্ট নেই, সেখানে কমিউনিটি সাপোর্ট খুব সামান্যই, সেখানে সোসাইটাল সাপোর্ট আরো কম, বরং নেগেটিভ। সেই ক্ষেত্রে পরিস্থিতি কি, কতটা ভয়াবহ, সেটা খুব সহজে অনুমান করা যেতে পারে।
ধন্যবাদ। Sorry, next question for you, Piya, is does domestic violence affect women differently than men, and how? How does it affect women differently, women and girls?
Well, I have worked with a lot of women, so the women.
Sorry, I'm asking all the women-related most.
Okay.
She has experience, definitely she would be telling that.
I had hoped that you would say, how does it affect men? Then I can show
not by choice, by default.
To men.
No. Yeah, but there are some specific impact. Yeah.
Well, the things that we've already discussed. I mean, because women are the majority of women. They're from they're. It's a patriarchal system, really, all over the world. Maybe one or two miraculous places in between that we don't know about. Otherwise, it's a patriarchal system, and in that system, as I said, cultures differ. Some places it's more subtle, and some places it's more brutal. But women are the minority in terms of not numbers, but minority because they are the weaker sex. So for that reason,
do they suffer injuries such as gynecological problem, women? So that could be different than men.
Well, the rape. The definition of rape is.
But this has nothing to do with rape. It's in terms of domestic violence. It depends on extent of the violence.
Yeah.
Do you think would they kind of suffer gynecological injuries in a long-term kind of impact? Do you think?
Well,
I mean, according to
I'm not sure I understand the question, but of course they do.
This is why, because most of the question overlapping, it's easy to get overlapped. The key was on this question is does domestic violence affect women differently than men? So, say for example, physically impacted, mentally impacted, it could be men and women both.
Okay.
Do you understand?
Okay. So I mean, straight away I can say that I do think that. Yeah. Well, men are, physically stronger than women. So obviously, it will usually be physical harm, but there is emotional harm as well. Whereas men may be subject to more emotional harm, But
you did mention rape. How about sexual abuse, sexual violence?
Absolutely,
that's gynecological impact. I mean, again, it depends on extent of the violence.
So physical.
Are you? Can you see what I'm trying to get out?
I think if I can just come in, I think
Yes.
it is important that we sort of also recognize domestic abuse and how sexual relationship and sexual abuse is impacted. In those situations, women are I don't have the percentage, but largely they do experience sexual abuse as well. And it is to do with power imbalance. It is to do with the physical strength of men, and it's also about their expectation. Men feel that women
So
are obliged.
yeah, absolutely. So
Women are,
I understand that. That is these are the reason, but my the key point was, do they um, does domestic violence affect women differently than men?
it
And the
does,
So
yes,
if I
key,
could,
yeah, sexual
absolutely, of
violence.
course.
yeah,
So like it
well,
could be
if I take
gynecological
the,
problem.
yeah,
I think
It could be
Pia sort of
temporary or permanent disablement.
yeah,
Yeah, they
Pia
can
sort
put
of
you
touched on that. She had, touched on that
depression.
in
Yeah,
the sense
yeah.
in the sense that
There is
it
one
does.
we need suicide lead to.
Yes, it would be, because if they're not able to, if they're not strong enough to report the incidents, they feel they're obliged to keep everything intact.
They're
They don't want
trapped. They're basically trapped in
they
the
don't want to report
situation.
these situation, because they are conditioned to sort of keep everything, because there are expectations on women to keep everything, keep a lid on everything. And so therefore, once that sort of pressure is exceeded, then what it results to is sometimes suicidal sort of impacts in the relationship, in the sense that they will attempt to suicide. So it has quite a catastrophic sort of outcome from that abusive relationship.
one
Thank you
thing
ever
I
so
would
much. Yeah, go on, Pia.
I would add, I mean, I'm not that much of an expert to say whether it would lead them to do suicide or not. I mean, the effects on men and women for domestic violence is the cruelest thing that could happen to you. I'm sure there's effects on men and women, and there are some who are committing suicide and nothing. But one thing I would say that, as well as the physical violence, because I know it's not about rape or anything, but you did touch on sexual violences. And recently we've heard a lot of sexual violence in Bangladesh and things like that. And there was a person who confronted me. I was on a program, and I was talking about rape, and then he said something like, oh, it's happening here, it's happening everywhere, and so therefore what I should have said, that it's happening everywhere, so it's okay. And so, I mean, what I would take a step back, and what really, as I have become older, and what I can see is we need to tackle the prejudices and the attitude and the the way women are viewed, and I think that has a huge impact on the way women are able to deal with domestic violence, or not able. I mean, they don't deal with it because of the stigma attached to it, because of the um, because of what's expected of them, and the cultural stigma, and that has to be worked out. And what I want to say is that, where does that come from? Actually, I think that comes from the top down. It's not, when we were looking at rape, we were looking at all these um, uh, uh, rural people, or unemployed people, or the working class who were doing these things. But actually, they are not, they don't go to prison, the law is not enforced, and also, and all of that is because of the way they are protected. The law, the society, the people in power, the more educated people protect them rather than the women. And so therefore it is, I mean, it is, I can see that, these countries are a signatory of the the CEDAW, as I said, the violence against women, and they have to put into place certain things in order to tackle this violence against women, and it's not been done. It's not been enforced, and the main thing is because of people in power and the more educated who have a more covert violence sort of going on, then you have the people who perhaps it's a bit out of the scope of your program. I do apologize, but because
No,
you
no,
were
that's
saying
okay.
because you were saying how does it affect them differently? So I mean, first of all, the most significant thing is the huge sheer numbers. 2/3 women are subject to one third of men. And also, if you look at the type of violences, as you rightly pointed out, Hashi, the sexual violences are hugely amongst women, against women. And there has been, I've dealt with horrendous cases. In Bangladesh. Marital rape is not recognized. There's no such thing as marital rape
I mean,
in Bangladesh.
yeah, yeah.
আমি
Okay,
Yeah.
so
একটা তথ্য দিতে পারি
we
এখানে
need to.
ছোট্ট
বলুন।
WHO এর একটা স্টাডি
চারটা
রিপোর্টে
বেজে যাচ্ছে,
বলেছে
আমাদের আরো বেশ
সরি
কিছু কোয়েশ্চন আছে। No, 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 it's okay.
না
Carry
আমি
on.
যেটা বলছি সেটা হচ্ছে এই বিষয়ে যে WHO থেকে একটা রিপোর্টে বলেছে যে ডোমেস্টিক ভায়োলেন্স ইজ এ গ্লোবাল পাবলিক হেলথ কনসার্ন এফেক্টিং 0.9% অফ উইমেন অ্যান্ড 20.1% অফ প্রেগনেন্ট উইমেন ইন দ্য ইউনাইটেড স্টেটস। যেখানে 1%-এর কম হচ্ছে ডোমেস্টিক ভায়োলেন্সের শিকার হয় আমেরিকাতে নারী, সেখানে মানে 1%-এর কম মানে যদি পুরুষ হয়তো তার চেয়ে অনেক অনেক কম মিনিস্কেল, সেখানে 20.1% হচ্ছে প্রেগনেন্ট উইমেন। আপনি যেটা জানতে চাচ্ছেন যে গাইনোলজিক্যাল কোনোভাবে এফেক্ট করে কিনা, আমার ধারণা যে এটা সেখানে তার উত্তর
Of
জানাচ্ছে
course,
এটা
of
একটা
course.
ইউনাইটেড স্টেটস এর
Sexual abuse আরেকটা আছে যে while women are pregnant,
এছাড়া
and
ডিপ্রেশনে
if
ভোগে
they
তারা
have
তাদের
been victim,
এবং
then
তাদের
child will be
প্রেগন্যান্সি অ্যাবর্ট
affected.
হতে পারে।
Absolutely, child will be affected.
রাইট
Depends
Yeah,
how many
yeah,
months within their early
yeah,
stage
absolutely.
they have to go through miscarriages, abortion. So those are the things I was looking for.
Yeah.
But anyway, thank you so much. Next question is for Khurshid Haque. It's a long question. You have to listen. Okay.
Okay.
The demand for domestic violence abuse support has increased since the pandemic began. How crucial is the support for those victims to you think? You think? And what support and service are available? So how crucial support service is important, and are there enough available?
In short,
Because
in
you are a
short,
senior social worker,
okay.
you are dealing with safeguarding on a
Right.
daily basis.
Yeah. So
There
in
you
short,
go.
no. In short, no. The demand is huge. We know the lockdown hasn't helped. The 2 lockdown that we've had, that has increased huge number of domestic violence. The number of calls has increased. Number of cases has increased. Do we have sufficient resources to deal with it? Piya sort of very clearly sort of stated earlier on, no, we don't. A lot of sort of non-statutory organizations are sort of not coping with the amount of referral that they're receiving. When we sort of look at our referral rates within social services that comes through the front door, that has increased as well. So in short, no, it's not. And how we are going to be able to sort of address those is something again. A study will need to sort of be done to combat that. It
But we
is
recognize that the supports are crucial. Support is needed.
ডেফিনেটলি
absolutely, undoubtedly is crucial. But the sort of in relation to other services and other supports that are needed for the global within the pandemic circumstances, this is one of the sort of support that needs to be looked into as well.
Yeah. So
Okay, thank you. Anyone else want to add?
Can I? So I would add to that what the government needs to do. This needs to be
Shahba, can you get Piya in, please?
shouted
I
out.
can see her. Yeah.
Okay. So what needs to be done then? The government needs to provide those crucial emergency services, even if you're in lockdown. I mean, to have no emergency services for people like that, there has to be some setup to help these people. There could be places where they could go. At least they could get away, because the main reason is because they can't get away. I mean, I read this horrendous case where, as soon as Boris Johnson said that there would be a lockdown, this man, this is actually on the news, I'm not making it up,
No, you're not.
I can give you a link to it. But the man turned around to his wife and he said, okay, now the game begins. He's a psychotic man. Now the game begins. So he will start. So at least the woman has nowhere to go. And this is what he meant, that you've got nowhere to go. So there has to be a place where these people can go. Maybe local authorities can be equipped so local authorities can provide places. I know there's funding cuts everywhere, so local authorities have to be given the funding in order to do these things, and this will make a difference, because every life matters.
Local government needs to work with housing, with other organization, and fund them where possible or where need be.
আমি কানাডার পার্সপেক্টিভ বলতে পারি সেটা। আচ্ছা, আপনি খুশি সে বলেন, আপনি যেটা আমাদের কানাডার পার্সপেক্টিভ একটু ডিফারেন্ট ফ্রম ব্রিটেন। এখানে আপনি জানেন যে বেশিরভাগ বাংলাদেশি কমিউনিটি বা সাউথ এশিয়া থেকে যারা এসছে তারা মোর এডুকেশনাল ব্যাকগ্রাউন্ড নিয়ে পয়েন্ট সিস্টেমে এসছে। খুবই কম লোক আছে যারা পলিটিক্যাল অ্যাসাইলাম নিয়ে এসছে, আমি খোলামেলা বলছি। তার ফলে শিক্ষাগত যোগ্যতা আছে ফ্যামিলিতে বলে হয়তো ডোমেস্টিক ভায়োলেন্সের ঘটনা তুলনামূলকভাবে কম ঘটছে। এবং এখানে যে সকল সাপোর্ট আছে তার মধ্যে ফেডারেল গভর্নমেন্টের সাপোর্ট, এইমাত্র আমি ওয়েবসাইটটা দেখলাম, আমাদের প্রভিন্সিয়াল গভর্নমেন্টের আছে, সমস্ত বিভিন্ন নন গভর্নমেন্ট অর্গানাইজেশনের আছে। ইন অ্যাডিশন এই যে বাংলাদেশি ক্যানাডিয়ান বাংলাদেশি ফেসবুক গ্রুপ আছে, তারাও কিন্তু কাউন্সেলিং করে এবং ওভার টেলিফোন, এবং তাতে কিন্তু অনেকটা হেল্প হয়। তারপরেও 22% বেড়েছে। সুতরাং উই নিড টু অ্যাড্রেস ইন এ ডিফারেন্ট ওয়ে to address this issue.
Thank you. Khurshid, I think you wanted to say something?
The thoughts have gone out of my head.
Okay, if any time is come back.
Yes, I'll definitely come back. Yes.
Okay, next question, Shaikat bhai, I was going to come to you. আপনার কি মনে হয়, আপনি একটু টাচ করেছেন, and like I said, এমন একটি বিষয় এটা often overlap হয় and আমাদের মাথায় এগুলি চলতেই আছে, সবগুলি ইস্যুই তো রিলেটেড। যাই হোক, এখানে যদি একটু এক্সপ্যান্ড করতে পারেন আপনি, আপনার কি মনে হয় ঘরোয়া সহিংসতার ক্রমবর্ধমান ঘটনাগুলি অর্থনৈতিক ও সামাজিক সংকট দেখা দিতে পারে? আপনি কিছুটা বলেছেন যে আমরা বলেছি এই রিজনে কনসিকুয়েন্সেস গুলি হচ্ছে, বাট forthcoming, যেহেতু এটা started, is begun in March, is still ongoing, is growing, হ্যাঁ, ভবিষ্যতে এটা যে সামাজিক এবং অর্থনৈতিক কি সমস্যা সংকট দেখা দিতে পারে?
ন্যাচারালি, যেটা প্রথমে আমি বলছিলাম যে আসলে কোভিড-19 প্যান্ডেমিকের ওয়ান অফ দ্য ওয়ার্স্ট ইফেক্ট হচ্ছে ইকোনমিক্যাল। প্রথমে তো হেলথ, মানুষ মারা যাচ্ছে, তারপরে হচ্ছে ইকোনমিক্যাল, তার একটা লং টার্ম ইফেক্ট থাকে, তারপরে সোসাইটাল এবং কমিউনিটিতে আছে, আর ইন্ডিভিজুয়াল পার্সনের মধ্যে তো থাকবেই। তবে ইন্ডিভিজুয়াল পার্সনের মধ্যে যে সমস্ত মেন্টাল ইলনেস সহ নানান ধরনের ইম্প্যাক্ট তৈরি হচ্ছে, তার ফল হিসেবে যে ডোমেস্টিক ভায়োলেন্স, জেন্ডার বেসড ভায়োলেন্স একটা গুরুত্বপূর্ণ বিষয়, সেটা আমাদেরকে আইডেন্টিফাই করতে হবে। এবং এটা খুব বড় ধরনের সোসাইটাল সমস্যা তৈরি করতে পারে বিভিন্ন দেশে যদি আগে থেকে কর্মসূচি না নেওয়া হয়, আগে থেকে তৈরি হতে হবে।
তো হ্যাঁ, এটা সোসাইটাল। দ্বিতীয়ত আপনি বলেছেন যেটা এটা ধরনের সামাজিক সংকট, দ্বিতীয়ত আপনি বলেছেন যেটা ইকোনমিক সংকট কিভাবে কমবাট করা যেতে পারে?
ইকোনমিক সংকট আসলে যেটা ব্যাপক, সেই তুলনায় ডোমেস্টিক ভায়োলেন্স খুব বেশি আলাদা করে নতুন কিছু করবে বলে আমার মনে হয় না, কারণ খুব ব্রড বেস ইকোনমিক ইম্প্যাক্ট হয়ে গেছে। তার মধ্যে এখানে কিছু ফান্ডিং লাগবে, কিছু হেল্প লাগবে, কিছু রিসোর্স লাগবে, কিন্তু ডোমেস্টিক ভায়োলেন্সের জন্য ঠিক ইকোনমিক ইম্প্যাক্ট হয় না ওইভাবে ডাইরেক্টলি, কারণ
ঠিক আছে, we'll come back to this. আমি আপনার I was researching on a brief published from UN, United Nations. It's a huge brief. They published one in 6 months back, and then second brief published, and they made a lot of recommendation in terms of ending violence, but we'll touch those towards the end to get some idea exactly what's happening and what UN is doing, and how the recommendation actually is not for one specific country, it's for the mainstream organizations, it's for the government, it's for the civil society, it's for everyone. So we will, if we have time, I would like to kind of read out a couple of recommendations. Okay, let's move on to the next question. If you guys have time, I think anytime later on, please have a look at that, especially Piya, you, I mean, all of you. It's a very interesting brief, and I was really stuck on. When I start reading, I carried away. Very, very interesting, and I will look at it again. Okay, Pia, next question is for you. Do you think the increase in domestic violence could lead a economic and social crisis for women, girls, in the long term? So specifically, because you're a woman, you are a lawyer, a solicitor as well, but because you're a woman, just not in general, specifically women and girls. And if it
So
is
I think
so,
because
what
of
kind of
domestic violence, sorry,
no,
you can.
yeah, domestic violence could lead to economic and social crisis, which you have established will lead, yeah. But in terms of specifically women and girls,
Well,
and
I mean,
if it is, what kind
yeah.
of?
Well, because of domestic violence, because of the abuse that women and girls in particular face, there is already economic crisis because of that. I mean, the economy could be so much
But we're talking
better
about long
if
term, a long term.
the long term the long term economic crisis is there is a very varies. It's variable. There's a you
Give us
know
some example.
there's a number of reasons, including Brexit, including the pandemic. So domestic violence, how much? It's a very specialist thing. You probably need to look into how much domestic violence is going to impact on that, and I'm sure it is will. I'm sure it will impact on that, but I can't give you any figures or all that, or say whether it will be worse than the actual the virus pandemic, or worse than Brexit, or something like that. So but there is government has been made available. In fact, they've made available about £2 million for helplines and online services to help people, to women of domestic violence. So it is a huge strain on the government. So that is an economic impact. It's made available 76 million to charities to help. After the first lockdown, the government has done this. So
Perfect.
of course it is
Okay.
another burden on the it is another burden on the state. Although things should have been in place to begin with, so they wouldn't need to do this.
Perfect. Okay.
But yes, it is a huge economic strain. Yes.
Okay. So, if anyone else want to add anything, if not, shall we move on to the next
এখানে একটা
question?
রিপোর্ট দেখতে পাচ্ছি, সেখানে একটা সার্ভে রিপোর্টে বলেছে যে to better advocate for effective measures to prevent and address violence against women, we must understand the scope and costs of such violence. By quantifying the effects of intimate partner violence on national economies, the vast scale of violence against women is highlighted, and ending it becomes an economic as well as social imperative. Intimate partner violence itself imposes an economic burden on those directly affected: households, the public sector, private businesses, and society as a whole. For example, the direct cost of violence against women on criminal justice and health system all provide a quantifiable analysis into the economic effects of violence. But the indirect costs are even more important to quantify because of their effect on women's labor force participation, productivity, education,
Yes.
and training. According
Absolutely.
to a study in India,
I
a
mean,
woman,
those are key
right,
crises
Yeah.
that they need to look into, and those are the key crises. Key crises will be faced by women and girls.
and it is in
I mean,
public
there's
health
one
problem.
thing that we may have left out. I think I think Mr. Shaikat, I think you covered this. The migrant women. This is another, because migrant women who come on a spouse visa. I also do immigration law. So when they come on a spouse visa and they are victim to domestic violence, then they can apply for the domestic violence route and go straight into having settlement into the country.
Right.
These women are already affected very badly because of all the obstacles that the Home Office puts up, and it's the
Definitely.
They
two
are
and a
in a
half grand.
precarious situation. They are in a
Definitely.
precarious situation.
Absolutely.
Unless they're getting status, they are not moving out. So
No.
that's a big problem. That's a big issue here
And
too.
they have no money, no help. Who is going to pay
They
two
have a
and a half
language
grand for
barriers.
your
They have
application?
they're kind of trapped every I mean,
Yeah.
it's
No access
yeah.
to universal credit, for
Right.
instance.
Yeah,
You
no
know,
access to public fund or yeah,
Yes,
absolutely.
right.
yeah.
So this is they are very, very hard hit. I'm sure the Home Office did say that they would be more helpful. However, I haven't seen much help in the, as I said, the case that I'm dealing with now.
So it can be said
Um,
So are there any plan,
they
Piya?
are in the
I mean,
blindsided
according
position.
to obviously we're practicing. You do some immigration cases. So have you had any support coming from the justice system or any kind of in terms of this these ladies
so
who
a Home
are
Office minister,
migrated? Yeah.
yes, a Home Office minister
I
says
mean,
that
there might be
they
some
do
women who
understand.
hasn't got their indefinite period yet, and therefore they are no they don't get recourse to public fund. You know, if you are not
Yeah,
permanent, if you don't have a residency, you are obviously will not have recourse to public fund, and
yeah.
therefore there is a huge consequences for them. So according to you, I mean, obviously you're dealing with
Yeah.
the cases.
Well, they've not
Uh,
done anything. They've not done anything specifically for this
no,
migrant group, but they have said overall, and they have put this money in 2 million, as I said, and 76 million for charities. What these women can do is approach charities to help them, and there are many charities who can help them, but they still don't have recourse to public funds. But these charities can help them. However, I mean, how feasible is that in a lockdown where they can't even sometimes get the evidence together because
to be able to, and this is why the main
yeah,
issue here is if they don't have their paperwork, they can apply for housing,
Right.
they can apply for
yeah,
public fund, they don't have a roof.
absolutely.
If you can't prove a roof, where do you get help from other services? Who's going to help
Right.
you?
The thing is, I mean, it's all very well having a big pot of money available, but if the legislation and the process doesn't make it easier for women to access those funds, it's absolutely ludicrous. It's pointless having those kind of funds available, and this is where the policies needs to be watertight and to be much more sort of. Focused on women, particularly who are in those kind of a situation. If they're vulnerable in that area, then the whole legislative framework needs to be sort of written in a way that it allows them sort of easy access for their immigration status to be sort of looked into. The fact of evidence, if they can't gather evidence, then their sort of situation is going to be really difficult. So all of those things needs to be made easy and simple for people. The element of again, and I would say the element of oppression works in that situation as well. The if the policies are written in a very patriarchal way, in a very sort of oppressive way, and the white supremacist way, then all of that is going to be
But
worthless for.
don't you guys think? I don't know. This is not something I'm kind of suggesting. I was thinking it's just come to my head. But in the interim, obviously there was no policy. There is this, that, etc. But interim now, though, this unprecedented time we are all facing, things are changing. We all are trying our level best to kind of to adjust to it, move on. Don't you think government, in terms of Home Office, they should even take into account women as such? Pierre mentioned that recently migrated, those who doesn't have this status. In the interim, have some kind of shelter, some kind of financial support for them.
Yes,
They,
I
they should.
I have
They
seen one
should.
thing that the most important, they are left out in all countries, I believe. The reason is they don't take the risk of losing their status because there is no inclusiveness in the policies, in the government rules and laws.
I understand that.
That is the most important thing.
Yes,
I
absolutely.
understand that. I mean, there is like Khurshid, you just mentioned that. I mean, the policy has written in a way that is so rigid and etc. But now, though, we are in that we are in a situation which is unprecedented. We all know it's just happened just like that. As a humanity ground, don't you think that government should have kind of start thinking for this group of women?
It's
I think we should implement it, not think about it.
So I think it is about priorities. It's about
Yes.
It's always about priority.
it is about priorities, and we have to sort of accept and understand that in an ideal society, in an ideal world, that's what would would be the case. That's what should be the case. We don't live in an ideal society, and so therefore we have to fight every corner for our rights. And nothing's going to happen without so you're not going to achieve anything without a fight being put up.
Absolutely.
Right.
So,
thank you so much. Let's move
Yeah.
on.
But finally, I think what's been missing up to now is the statutory duty on the government, statutory duty on the local, because it's all been, there's no domestic law legislation. You have to use criminal law, you have to use other law and sort of find your way around it. So
yes.
this needs to be made absolutely clear. There needs to be a piece of legislation that holds, accountable the state, the local, then women's, I do use the term.
I mean, where there is a crisis, where there is an unprecedented crisis, I'm going to give you an example. We women at home, when we run home, we keep our spices, we keep reserve of something, don't we?
Yeah.
Whatever.
So I know you were talking about also.
So like government. I mean, in a crisis situation, I understand. We have every pot. We have criminal law, we have this law, we have that law, we have housing association, we have local authority, we have this, that, we have sheltered. I mean, I'm aware of the fact that because I work for the central government, I know there are some shelters who provide evidence for the people to kind of claim for housing a certain benefit. A letter or something they might do. Not all the shelter, but some. So don't you think?
I think, but what Piya is saying that it needs to be. Sorry, Piya.
If Haque, what I picked up throughout the program, the message that you are giving, and I'm absolutely 100% agreed with you, is basically, when we talk about priority and when you talk about the cost on the economy, you're absolutely right, because the cost on the economy is huge. You don't need an amount, it's huge. And it should be prioritized as a number one priority, because women are half the population. Women are half. Qazi Nazrul Islam said
more than half.
More than half, exactly.
Some countries.
So without this half of population, if you disregard half of the population, if you do not have law to help them, if you do not have systems to help them, then you are committing economic suicide.
How can you progress when half of us are behind? How?
Okay, so what you're saying, Piya, basically is that it needs to be put into statute.
Absolutely, there should be statutory.
Unless it is in statute, in law, specifically saying that domestic abuse is going to be dealt with in this way, and that each organization who have the responsibilities to investigate, such as the police, housing, offering appropriate accommodation, social care, and all of those things, all of those individuals and organizations become responsible. I don't think we're going to get anywhere.
Absolutely.
I think that is the key issue here, that we need to make people, individuals and organizations accountable.
Absolutely. And domestic violence is a violence. It's not just, sexual abuse or that abuse or aggravated assault or, you don't need to use, domestic violence has to be realized. It's all over the whole world. Why can't it be
And
recognized
Every
as a
corner of
to
the
be
human?
dealt.
world.
It
Every
needs to be
corner of
dealt
the
with
world.
on its own merit. That I think,
Absolutely.
Okay, guys.
not just sexual abuse, and I think what you're saying is that it needs to be dealt with on its own merit.
By
You guys
specialists
are
in
so much.
domestic violence.
On
Absolutely.
that note, we need to move on to next question. Thank you so
Yes.
much indeed for all of your contribution to this question. Okay, next one to Khurshidul Haque. Do you think COVID-19 and domestic violence increase vulnerability and reduce access to support service? And how does it impact on ability to access help? We touched throughout our program, but
Yeah,
be
yeah.
little specific this time, and so that আমাদের দর্শকদের একটু direction থাকে.
Right.
So
Okay, so in terms of reaching out for services,
increase vulnerability as a result. Support
definitely
service reduce. Yeah.
it's increased vulnerability in the sense, purely because of the lockdown, purely because they're not able to get out, purely because they're not able to have access to professional services because other
Yeah,
emergencies are.
particularly healthcare, social care, police and justice sector, emergency services.
Exactly, because they're all the other organizations are dealing with other crises, and so therefore less priorities, less attention is given to a domestic violence, and that is because it's not legislated. It's not legislated in the way that we're accountable as a statutory service that needs to be provided. That's the reason why we're sort of in that vulnerability. Reaching out for the services, what is there, it's like I said earlier, it's all very well to have a huge pot of money, but if that money sort of isn't used wisely, appropriately, adequately, and so if it doesn't reach the people or the victims, then it's pointless having those sort of kind of money available.
Okay,
It's going
guys.
to make it really difficult.
Shah Bhai is calling out. He already
We exceeded.
saying that we're running out of time. We need to finish off. Okay. Is there anyone wanted to add to this question so that I can swiftly move on?
ডেফিনেটলি
Anyone want to
যে
add
বিষয়টা
anything?
আমাদের আলোচনা থেকে বেরিয়ে আসলো সেটা আমরা খুব স্পষ্ট করে আইডেন্টিফাই করা দরকার যে কোভিড-19 এর একটা যে ইম্প্যাক্ট আছে মেন্টাল ইলনেস, মেন্টাল হেলথ, এছাড়া ইকোনমিক, সোশ্যাল হেলথ, তার মধ্যে খুব গুরুত্বপূর্ণ একটা বিষয় ডেফিনেটলি যে ডোমেস্টিক ভায়োলেন্স, এবং সেটাকে অ্যাড্রেস করার জন্য আইনগত এবং আপনার অর্থনৈতিক এবং কমিউনিটি সোসাইটাল সাপোর্ট সবগুলোই আমাদের দরকার, এবং সেই জিনিসটা আইডেন্টিফাই করাটা জরুরি এই মুহূর্তে।
আপনাদেরকে আমি 1 মিনিট পজ করতে বলছি। তার আগে আমি আমার দর্শকের জন্য আমি ইম্পর্টেন্ট মেসেজটা দিতে চাচ্ছি যে যারা আপনারা যদি কেউ ডোমেস্টিক ভায়োলেন্সের শিকার হয়ে থাকেন অথবা আপনারা যদি জানেন কেউ হচ্ছেন, আপনার বন্ধু-বান্ধব, নেইবার, আত্মীয়-স্বজন, আমি জাস্ট রিড আউট করছি এটা গভর্নমেন্ট ওয়েবসাইট থেকে। If you or someone else in the immediate danger, please call 999 and ask for the police. If you are unable to speak, you can use the silent solution, which is system from a mobile phone, call 999 and then press 55. The operator will then put you through to the police, and then the police will try to communicate with you by asking simple yes or no question. So it's for the people দর্শক যারা watch করছেন। আমি একটু পড়লাম আপনাদের জন্য, এটা gov.uk ওয়েবসাইটে এই ইনফরমেশনটা আছে। আপনাদের যদি আপনারা নিজে কোনো ক্রাইসিস ফেস করছেন, ফ্যামিলি মেম্বার, বন্ধু-বান্ধব, আত্মীয়-স্বজন, নেইবার, or if you notice whoever, any stranger even, is come to your attention, প্লিজ এই ইনফরমেশন গুলি পাস করবেন অথবা তাদেরকে বলবেন যে এটা গভর্নমেন্ট ওয়েবসাইটে আছে, যে ইটস নট নেসেসারি তারা যদি ভিকটিমের ভায়োলেন্সের শিকার হন এবং পারপেট্রেটরের সামনে থাকে, অবভিয়াসলি তারা কল করতে পারবেন না, but there is a system whereby through 999 then 555 if they press, and then police operator will The operator will then put you through to the police, and then police call a question, you can only say yes or no, etc. And there are some other information. Okay, the very final question to all of you, and then I will quickly read through the briefing, and then we'll finish off. Okay, final question
Hashi,
is
just before you ask the question, can I just wanted to add the briefing you've just read out. I think it is important. I need to add the women who are not able to communicate in English, is that on itself is quite oppressive.
Absolutely.
So
and there will be quite a large number.
Yes,
Yeah.
of
So this is why I said there
who are
are
subject to domestic violence are not going to be able to use those apps.
Absolutely. And this is why they need to go to this website, read it through, and find out what are the services available. I mean, if they call refuge, even if they have a number to call, there will be interpreter. Some service will. It depends on the circumstances they are in. Sometime they might be stuck in a circumstance whereby they can't even access the phone. They're locked in.
Absolutely.
Their perpetrator will lock them in. But if you can't call someone, you can't get help. Do you understand? So I mean, I don't know, but I think you raised a very important question that we need to look out for our loved one, people around us. If you feel that someone is going through these circumstances, we need to talk to them or get help if possible, help each other. Okay, so last question, guys. Thank you. এত সুন্দর আলোচনা করলেন আপনারা, আপনাদের সবার কাছে যে how would you recommend COVID-19 and ending violence against women and girls? So what would be your last recommendation? How could this be ended? COVID-19 and domestic violence. I know it's long run.
That's a very tough question. That is, how will you
make your recommendation, because you are part of this society.
You have to do
very tough. It is very. Khurshid, a minute ago you said we have to shout out for things. It doesn't come to our hands.
No, I think that, what I was saying.
Make your recommendation and then.
Lobbying, I think, sort of lobbying to change the legislation, or bring a legislation in force that will sort of cater for women who are in that kind of situation, and will give them the freedom to be able to challenge their partners in a way to free themselves from those kind of violent and abusive relationship. So that could be a start. Financial element needs to be available. Huge publicity needs to be available within the wider community, as well as specific communities in their own languages. There needs to be several workshops to be conducted by professionals who are already involved dealing with domestic violence. That includes the police, social care individuals, refuge, housing, education, mental health professionals, and everyone who are playing a significant part in terms of supporting women who are in that kind of situation.
Perfect. Thank you so much indeed. Piya?
Of course. I mean, first of all, do program like the one you're doing now. Make people aware what they can do under these circumstances, what you're doing. Thank you very much. And also, as a lawyer, I would say, of course, tighten the law, what has just been said. And also, I mean, there is that there is like in every, I mean, like there's not enough time on your program to go over it, but in every area, like in criminal law, you could get somebody convicted for beating up his wife badly, raping, whatever, and then in the family court he could easily get access to children. That is also a weakness in the law, and it's making, it also has effect on the family. So obviously, tighten up the law, as has been said, and the money is available, and we just need to make people aware of this. Of course, it's not something that will go away overnight, And a huge part of it is to challenge cultural challenge cultural abuses and under the name of culture and religion and this and that, when it's not. It's nothing to do with religion, whatever. It's just it's a really negative sort of all the when you look at culture, for instance, there's many good things about culture that we want to carry on for 1,000 years, but there are many negative things that have been passed down from generation to generation, and those are the things we need to target and do more programs about, make people aware. I mean, I'm going at the underlying causes of that, and of course, hand in hand, use the law and enforce it.
Thank you so much.
Thank you.
Shaikat, Rushdie,
হ্যাঁ,
আপনার recommendation.
ইতিমধ্যে খুরশিদুল হক এবং পিয়া তো বলেছেন স্পষ্ট করে, সেগুলো নিয়ে বলতে চাই যে আসলে কম্প্রিহেন্সিভ ওয়েতে অ্যাপ্রোচ করতে হবে এই পুরো বিষয়টাকে, যে কোভিড-19 কিভাবে ইম্প্যাক্ট করছে মেন্টাল হেলথ এবং ডোমেস্টিক ভায়োলেন্স, যেটা খুবই একটা বিপজ্জনক পর্যায়ে ইনক্রিজ করেছে ইতিমধ্যে আমরা আইডেন্টিফাই করতে পেরেছি। তো এই কম্প্রিহেন্সিভ ভাবে যে অ্যাপ্রোচটা দেখতে হবে, এর মধ্যে ফার্স্ট হচ্ছে আইডেন্টিফাই করতে হবে বা ডায়াগনোসিস করতে হবে যে ইস্যুটা আছে, এবং সেটার জন্য আমাদেরকে লবি করতে হবে, কথা বলতে হবে, আলোচনা করতে হবে, এবং যেটা বলেছেন পিয়া এবং খুরশিদুল হক সাহেব, যে আইনগতভাবে এটাকে একটা সংশোধনীর মাধ্যমে প্রায়োরিটি সেক্টরে আনতে হবে, যেটাকে কিভাবে অ্যাড্রেস করা যায়। একই সাথে ফাইন্যান্সিয়াল সাপোর্ট, কমিউনিটি সাপোর্ট, সোসাইটাল সাপোর্ট দরকার হবে, এবং দ্রুত যাতে সবগুলো বিভিন্ন যে আইনের মধ্যে আলাদা আলাদা ফাঁক রয়ে গেছে সেগুলো, আবার যে সমস্ত মানুষ ইমিগ্রেশন স্ট্যাটাস এখনো হয়নি বলে লেফট আউট রয়ে গেছে, তাদেরকে সবাইকে নিয়ে যেতে প্রপারলি, বিশেষ করে একটা আর্জেন্সি দিয়ে এই কোভিড-19 উত্তর সিচুয়েশনকে বা এই সময়টাকে অ্যাড্রেস করা যেতে একটা কম্প্রিহেন্সিভ অ্যাপ্রোচ নিতে হবে, এবং তার জন্য আমাদেরকে কঠিনভাবে কাজ করতে হবে।
অসংখ্য ধন্যবাদ। আপনাদের সাথে স্টে উইথ মি, ডোন্ট গো ইয়েট। আপনাদের সাথে আগে যেটি বলছিলাম যে ইউএন এর যে ব্রিফিংটা, they made a many recommendation for the women organization, civil society, for the government worldwide, actually loads of recommendation. I'm just going to read out a couple just to add to your recommendation. You guys made some excellent recommendation which will probably overlap with there as well. So some of them are allocate additional resources and include evidence based. Well, basically the recommendation is to end the violence for women and girls. In quotation, and I'm reading out from their website, it's not my word anyway. So include evidence-based measure to address violence against women and girls in COVID-19, national response plans, that is key. Strengthen service for women who experience violence during COVID-19, treat service for women who experience violence as essential service. Strengthen service including shelter through capacity, rapid assessment, and through design of risk assessment, safety planning, and case management. Ensure psychological support for women, you guys say it again and again, and girls who experience violence, and frontline health, and obviously social support worker. Expand the capacity of shelter, include purposing other space such as empty hotels or education institution to accommodate quarantine needs for the women. So basically, if someone become victim and they need to quarantine, so that should be something available for them to shelter, basically. This is what they're saying. Build capacity for key services to prevent impunity. Obviously, they also recommended for the funding, raise awareness of police and judiciary about the increase of the violence against women and girls, and train fast responder to psychological support. So basically, they're saying working together is not only one organization, it's not only one country, because domestic violence is a pandemic that is happening every corner of the world, regardless of race, gender, sex, class, economy, social status. It doesn't matter. It's happening every corner of the world. It's happening every society, every culture. So therefore, we need to work together. So thank you all very much for taking part in this discussion. all the way from Canada, all the way from Birmingham, all the way from London. And tomorrow is a working day for all of us, and I really appreciated your contribution. And অনেক অনেক ধন্যবাদ আপনাদেরকে পার্টিসিপেট করার জন্য আমার শোতে। আশা করি ভবিষ্যতেও আপনাদেরকে পাবো। তো দর্শককে বলছি যে দর্শক, আপনাদের সবাইকে আমি বিদায় দিচ্ছি, আর আমি দর্শক থেকে এখন বিদায় নিয়ে নিচ্ছি যে আমরা অনুষ্ঠানের প্রায় শেষ পর্যায়ে। আশা করি আপনারা আলোচনা শুনেছেন, এবং আপনারা যদি বেনিফিটেড হয়ে থাকেন, প্লিজ ফিল ফ্রি টু লাইক, শেয়ার এন্ড কমেন্ট। আপনারা যদি কোনো এপিসোড মিস করে থাকেন, ইউটিউবে আপনারা লগ অন করতে পারেন, লন্ডন বাংলা ওর আগামীর পথে ও হুসনা খান হাসি, ইভেন গুগল করতে পারেন, সবগুলি শো আপনারা পেয়ে যাবেন, অথবা ইউ ক্যান ফলো মাই পেজ। সো আপনাদের সকলকে অসংখ্য ধন্যবাদ আমার সাথে থাকার জন্য, এলবি লন্ডন বাংলার সাথে থাকার জন্য। আবারও আপনাদের সঙ্গে দেখা হবে আরেকটি টপিক নিয়ে, আপনাদের মাঝে শিগগিরই ফিরবো। আপনারা সকলে ভালো থাকুন, সুস্থ থাকুন, লুক আফটার ইয়োরসেলফ এন্ড কিপ সেফ। সবাইকে শুভরাত্রি।